Hi, everybody. Mary Ferguson-Perret here, and so glad that you're tuned in with us today because we're going to talk about H1N1 and about the vaccine and getting your shot, which I know you will do. And we have a couple of experts here who are going to help us to sort of engage this discussion, and I'm going to ask all those hard questions that you would want me to be asking so that you can make the right decision to get the vaccine. So, first of all, I want to introduce both Susy Hota and Clarie Mallette, who are here with us. And Susy is an infectious disease specialist here with us at UHN and is taking a very strong leadership role from the medical perspective in terms of all of the infectious disease effort here, but especially this H1N1. She's been intimately involved in this for many meetings we've had. And so let's just start, Susy. Perhaps you could just sort of in a nutshell tell us, is it here, what's going to happen in the next, say, month or two, and what should we expect?
Well, it's definitely here, I can say that much. We've really seen over the last couple of weeks that there's more localized activity of H1N1 in Ontario. It started off in Canada, I think mostly in BC and Northwest Territories, but I can say for sure even locally here in the hospital we're seeing the odd case come in, more so than we did in the last few weeks. So definitely seeing that change.
Now, I've had the great pleasure of hearing many presentations from Susy in many forums about this, and I always remember the graph which she puts up on PowerPoint, which shows this like great big peak, like the Matterhorn, which suggests that once the flu begins, that the numbers of cases can escalate very quickly. Is that what we'd be expecting?
Oh, absolutely. I mean, flu can go through populations pretty quickly, and, it can affect a lot of people in a short period of time. We saw that in the spring when it was something completely new and, people were susceptible to it. And we still have a pretty large number of people who are susceptible moving into the fall. So we know that flu season's here. It's here a little bit earlier than usual. And we expect that, over the next couple of weeks, we're going to see probably quite the escalation in numbers. So yeah, I think we're prepared that we may have our flu season starting a little early this year.
Now, there's a lot of controversy about the issue around whether to get the regular flu shot first, whether to get the H1N1 flu shot, and I know that we have a special take on that for healthcare. Mm-hmm. So can you just say, just tell us, what exactly do we need to know here as healthcare professionals about which shot to take first and how to proceed with that? Okay.
So I think the bottom line is in healthcare, everybody should get both shots. That's my opinion about it. That's what most people feel. And the reason is when you work in healthcare, you're working with patients. You're not just considering yourself, you're considering that you're working with people who may be susceptible to getting complications and, more severe illness. So, we have an obligation to protect the people we're here to care for. Also, you're protecting your family. I mean, you're reducing that risk of introducing the flu into your family. So I think that's an important thing to say. And you're protecting yourself from getting what's usually a pretty lousy feeling illness that might last you a week. For the vast majority of people. So that's my bottom line about vaccination. Now, how we're actually going to roll that out, it's going to take place in a slightly different way from what we usually see with our seasonal flu campaign and everything. So we're actually doing it in a bit of staged approach. So to summarize it, I guess, right now we're offering the seasonal flu shot to people who work at UHN who are over the age of 65, and that was decided actually, by the Ministry of Health because we expect that the vast majority of what we're going to see in the upcoming months will be H1N1, but we know that there may be a little bit of seasonal flu going around, and people over 65 are the people who benefit the most from seasonal flu vaccination, and it protects them the most from complications. So everybody else, the moment we get the H1N1 vaccine, we're going to be putting all of our efforts into getting that vaccination out to all of our healthcare workers here. And that's sort of our next priority.
So that means then that for those of us who might be over 65, we would go immediately to Occ Health and get the regular flu shot. But then would that be followed by H1N1 as well for the over 65 folks?
Yes. So right now we're saying get your flu shot, your seasonal flu shot, if you're over 65 from occupational health clinics. Once we get the vaccine physically on board, the H1N1 vaccine, we will actually launch our flu campaign, what we normally do every year, and we'll be seeking out people, allowing them to come to us. We'll have the roaming carts, and we'll try to immunize everybody. There doesn't appear to be any safety issue about getting the two vaccines at the same time. You'd have one in each arm. It's a choice you might want to take. Personally, I feel that you should probably separate it, because if you get a side effect from one, you wouldn't know which one caused it. So probably best to separate it over time. Now, the third part of this that I didn't get to before was that once we've kind of finished all the H1N1 vaccination and we're well into the sort of season, the flu season, we will actually get more of the seasonal flu vaccine for everybody else. But that will happen later than usual this year, so probably December, January is when we'll get some more vaccine for everybody.
Okay, now, now I'm going to give you the hard questions. A lot of staff have spoken to me about they just aren't sure about whether they want to get this vaccine because it's new, because they're worried that it could make them sick, because there's some thinking out there that it's a live vaccine, and that's a little different than the other kind of regular flu shot. Can you tell us, are any of these things true, and do we have to be concerned about these things?
So a couple of things. First thing I'll get is I'm going to debunk the whole issue of whether it's a live vaccine. This is not a live vaccine, so that concern should not be there. So in other words, it's safe if you're pregnant to get it. It's safe to get it if you've got a compromised immune system as well. This is an inactivated virus. That should not even be a concern. The second thing was about the adjuvant. And I think this is where people are getting a little bit more confused. The adjuvant really is a compound that you add to a vaccine, the active components of it, so that you can boost your immune response to it. And we did that so that we can use the lowest dose possible to get that vaccine ready into a large number of people out as quickly as possible. The adjuvant hasn't been tested in pregnant women very much, but the feeling is that it's probably actually very safe in pregnancy as well. But because we realize that people have concerns about that, Canada decided to purchase some vaccine that didn't contain the adjuvant and have that available for women who are pregnant and kids under the age of 3, where there's also that small concern. It's theoretical as a concern. That being said, we're not going to get that non-adjuvanted vaccine until a little bit later. So right now what we're going to be getting is all the adjuvanted vaccine, and it becomes a bit of a choice if you're pregnant whether or not to accept that.
But aside from being pregnant, if you're not pregnant, basically what you're saying is no worries.
There are always some groups of people who have problems like allergies to components who probably shouldn't get the vaccine. So we know that this vaccine was made up in eggs. So if you have any allergies to eggs or egg components, you shouldn't be vaccinated with this vaccine. If you've had allergies or allergic reactions to vaccination in the past, there's something else in that vaccine you're allergic to, then you can't take this as well. But the vast majority of everybody else, there's not so much of an issue. It's pretty well tolerated.
So it sounds like bottom line, folks, there's nothing to be worried about here unless you fall into those two small categories, and that you better get the shot, right?
Absolutely, yeah. And we have a lot more information as well posted on our website and on that pandemic website as well about the vaccine.
Well, thanks for giving us this overview, Susy, and I want to now speak to Claire Mallette, who's our Director of Nursing Education, and Claire really is going to answer some questions about what about the students? We have thousands of students in this place. Is it the same deal for students?
It absolutely is the same deal, Mary. If we have students, if you are a student here at UHN, then we are following the same practices as our staff. We encourage you, and you can get the vaccination by the roving cart. Just show your UHN name badge, and you can get the vaccination. We welcome you throughout this experience. We want you here. We will need you here, and we will talk with your instructors and you if it unfolds. Hopefully it won't, but if it does. So you can get your vaccination, and the same is for the students.
Great. So now here's the last, final, big, hard question. Are they still going to have chocolate bars on the carts?
Absolutely.
Oh, okay.
I wouldn't allow that to happen.
In actual fact, the chocolate has been delivered, and we're waiting for the vaccine.
Yeah, and Claire and I are going to have to taste test the chocolate to make sure it's up to standard. So we'll make sure that that's in place.
Perfect. All right. Thank you both very much, and thank you for being with us. And be sure that you get out there and get your vaccine. Talk to you later. Bye-bye.